Welcome to The Big Unlock, where we discuss data, analytics, and emerging technologies in healthcare. Here's some of the most innovative thinkers in healthcare information technology talk about the digital transformation of healthcare and how they are driving change in their organizations.
Hello, everyone. This is Paddy, and it's my great privilege and honor to invite as my guest on today's podcast, Lidia Fonseca, CIO of Quest Diagnostics. Lidia, welcome.
Hi, Paddy. Nice to be here.
Very good, very good. So, Lidia, for the benefit of our listeners, if anyone is not aware of who Quest Diagnostics is, do you want to take 30 seconds and share a little bit about the company?
Sure. So Quest Diagnostics, right? We are the leader in diagnostic information services. We deliver actionable insights to help empower better health to the industry. We've been in business for more than 50 years, and we definitely focus on providing not only diagnostics lab services, but also deliver population health and data-driven solutions that help industry participants, whether they're consumers, providers, hospitals, and payers, to make better decisions about healthcare. And we are 45,000 employees strong and pretty large footprint in the U.S. Other parts of the world as well, but pretty heavily dialed or in the U.S. And I would say other kind of notable facts about Quest is that we serve 1 in 3 Americans every year. We're connected with more than 650 EHR platforms, and we're connected to 50% of hospitals and have more than 470,000 providers that interact with us and are part of our network. And the last bit of piece that I think is notable is that we do have a big data backbone of more than 40 billion test results, one of the largest data sets in healthcare. And again, we really leverage that data to provide insights into the industry.
Right. So, and I know, Lidia, you have a very unique perspective on this whole industry, because on the one hand, as the CIO of Quest Diagnostics, you are a buyer and a consumer of technology solutions. But on the other hand, you also wear the hat of someone who leads the new offerings, the ones that you talked about, data and analytics and so on. So do you want to talk a little bit about the two different hats that you wear?
Sure. So as you say, Paddy, right, I serve as the CIO for Quest, and everything that you're accustomed to associate with the CIO, right? Networks, data operations, security, data center operations, security, email, right? And then I also serve as a CTO for the company, and we develop client-facing solutions, technology, software, as well as all of the analytics capabilities as well, which enables us to really bring to the market through our Quantum. All of our data and technology services are delivered through our Quantum brand. So Quest Quantum is our brand of solutions that we communicate and we extend to the market. And so you're right. On the one hand, I live the life of the CIO. And on the other hand, we're also, product creation and technology innovators as well, which is great.
Yeah. That must give you a really unique perspective on the market. And that's a great segue into this recent announcement around a blockchain pilot that Quest is a part of. First of all, for listeners who may not be really familiar with what blockchain is all about, do you want to kind of provide your definition of what it is and what it can do for healthcare? And then we'll jump into what this recent announcement is all about.
Sure. So, when we think about blockchain, the way I'd like to characterize it is, blockchain is a distributed database, and that's cooperatively owned. And this distributed database or ledger is used to collect, share, and exchange information among different participants. And I'll tell you that blockchain is most useful when loosely coupled organizations want to confidently and transparently share information, automate manually beneficial processes, and audit those interactions. So when you think about, the pilot that we're embarking on with the other companies that we announced, if you think about provider data, which is the first use case that we're tackling today, right? Each of us individually maintain that provider data in separate and independently managed IT systems. And what we're doing is we're actually creating a blockchain where we bring this data to a common blockchain instance, right? This distributed database that I mentioned. And then, we're all committing to actually updating that information. And whenever any of us that participate in the blockchain make a change, that change becomes automatically available to the rest of us. The reason why that's really important is that you can imagine, right, if each of us are maintaining independent information, not only is the information not necessarily complete, but there's a lot of redundancy, right, and extra cost because each of us are maintaining these databases independently in separate systems. So that's, how I like to describe, what blockchain is and also what blockchain does.
Right. So I have a two-part question here. How did you end up picking this use case for blockchain, this provider data management? And did you have, why pick blockchain to solve this problem? Could it not have been solved by other technologies?
Sure. So, so to answer your first question, right, there's one of the things that attracted us about this use case is that provider data, right, it really is a key building block for certain pretty key processes in the industry. So you need provider data to process claims, for payments processing, and also, right, the payers are all required to have up-to-date provider directories. Now, that use case, right, if you think about, there's some research, and they've estimated that the industry spends about $2.1 billion a year across the industry chasing and maintaining provider data. And through this project, we believe that 75% of that cost could be eliminated by having a single source of truth. So that's what we're aiming to do. And the reason why blockchain makes sense for this is because the blockchain, by definition, is a distributed database, right? And so imagine that we're going to have in that distributed database that single source of truth about provider data. And blockchain, the way the technology lends itself for those of us that participate, right? So we're going to be updating, right? Because we're having interactions with providers, all of us that are part of the alliance. And so we're going to be providing updates, and we're committing what's unique about this, because I think the technology as blockchain can really enable this distributed database, this ability to update information and then make it available to all the participants. I think what's unique about this is that when you think about, Optim, Humana, Optim, Multiplan, Quest, and United Healthcare, the five of us, what's unique about this is that we're willing to cross across company boundaries to actually improve the quality of the data and therefore speed up claims processing and payments processing. And, in that process, also reduce the administrative burden in the industry. So we definitely see it as a great fit for blockchain because of the nature of blockchain to have that distributed, a database with the other elements of blockchain that enable you to have a single source of truth that's then available to participants.
Yeah, that's 75%. You expect this solution could address, as much as 75% of the 2.1 billion in provider database maintenance costs. Did I hear you right on that?
Yes, provider data, correct.
Wow. So now, obviously, this initial consortium has several big names, United Healthcare, Optum, through Optum, and Humana, and yourself. Do you see this as a start? Do you see this growing as a consortium? Do you see this solution kind of spreading across a broader network? Is that the longer term vision, or is it going to be a fairly closed uh, sort of network?
No, our aim is so blockchain, right? Our belief is that the more participants there are, the better it is for the industry, right? Because then you can have a more complete data set. We're starting, there's these 5 founding member companies, and our plan is that through the pilot stage, we're right now in the pilot stage, we wanted to keep the participation manageable to get through the pilot. However, we are having a lot of conversations because we've actually been approached by a number of organizations that want to, participate in the effort. And so our plan is to get through the pilot because we have a number of goals, right? One, we want to leverage, right? One of the goals is that we want to prove that the blockchain technology can be an enabler for this. We believe that, but we want to, we're using the pilot to prove that. We want to improve the data quality, both completeness and accuracy. That's another goal that we have. And goal number 3 is to reduce the administrative burden, right? We want to see and we want to be able to measure the improvements. So our goal is to get through the pilot, and then we're going to be providing updates on how we're doing on the pilot. But then our goal is to open it up and have participants from across the industry, because we believe that the more participants, right, the more complete, right, the data set is.
Right. When do you expect to see results from the pilot? What's the time frame for an initial set of proof points, if you will?
Our aim is that towards the latter part of the year is when we're going to be coming back and sharing, what we've learned through the pilot, and also what, next steps. So expect towards the latter part of the year, towards the end of the year.
Right. No, I'm certainly going to be looking forward to hearing more about this. So in general, kind of taking a step back, if you will, in general, what do you see as the interest and adoption level for blockchain today in healthcare? Now, it's still very early. I guess it's fair to say that blockchain is still very early in healthcare, although in other sectors like banking and finance, it seems to be moving ahead a little bit quicker. And of course, blockchain has been most commonly associated with Bitcoin, which is a whole different story in and of itself. But what do you see happening in healthcare today? What are some of the other use cases that you're seeing, or what do you see as the outlook for blockchain?
Sure. So, you're right. In healthcare, it is early days for blockchain. I think, we are expecting and, hoping that this pilot is going to bring, some tangible proof points that, will give the industry more confidence. And, so we definitely want to be able to provide through the pilot, a real use case. So we're excited about that. As far as what other opportunities are available for healthcare, I think, other data sets, I definitely, I think the collaboration, the ability to improve, through improving the quality and the, completeness and accuracy of data, while we're starting with provider data, we certainly envision other use cases in the future, one step at a time, right? We want to first prove this one, but we do, if you stay with the concept of the single source of truth, right? If you think about healthcare,
right,
and if you've been in healthcare long enough, there's been a couple of common challenges, right? One is interoperability, and the other one is the completeness or, the quality of the data, right? And what we see, blockchain can actually help to address both of those. And so this pilot, right, like I mentioned, right, you have these 5 companies pretty decent, big-sized companies in their own right are willing to cross company boundaries to be able to actually, exchange information and provide, real-time updates. So I think that addressing the opportunity of interoperability, which has been a theme for as long as I've been in healthcare, and I've been in healthcare for a while. And then the other one is connecting the dots about, so the quality of data. So we can see other use cases. Our view is that let's prove it out. Let's prove the technology. Let's show that, by collaborating and exchanging information, and, we can improve the data quality and therefore speed up transactions, speed up claims processing, and then also reduce the administrative burden. So if you think about it, then achieving those three goals will open it up for us to look at other use cases. And there are plenty of use cases that we can go after once we prove, that we've improved provider data.
Yeah. And you mentioned claim processing, and I know that there's at least one solution out there that addresses revenue cycle management as an area of opportunity. And in the pharma industry, they've talked about the supply chain processes, right? The provenance of drugs in the supply chain, and using that as a not just a single source of truth, but also to kind of track the provenance of the drugs and ensure the integrity of the supply chain and so on. So those are some of the use cases that I have come across. I don't know how far ahead they are, but yours is the one that seems to have made the biggest impact, at least in terms of a handful of major industry players coming together to do something like this. Now, I was surprised by one thing, which is that in your consortium, I didn't see a health plan, a health system, and they should be, right, a part of this whole process of ensuring the integrity of provider data. Any reason why there isn't a provider in the consortium?
I think, we started with the five of us, right? And again, we wanted to keep the group at a manageable level because we wanted to get through the pilot. And, I think you can consider us a provider in that sense because we are a provider of, services into the industry. But, there's, like, as you mentioned, right, there's three payers, and then you have a provider group. You can consider Quest a provider of services, and then multi-plan, right, which is more of, they're more of a providing exchange services and, some of the kind of revenue and connections, right, between payers and other providers. Again, something that we are certainly open to, but we wanted to get going on this. We are very excited about what we can achieve. And so, but we definitely are, at some point, once we're a little bit further on, you can anticipate that, there will be, really participants from from all over the industry, including health systems and provider groups.
Right. No, that'd be exciting. Now, so this is an exciting start, and obviously, there's going to be some challenges because you're pioneers, right? And as pioneers, you're going to have to be the ones to overcome the initial challenges and show the way for the ones who are going to follow. What do you think the biggest challenges are going to be in the first phase of this project?
It's interesting because if you had asked me this question 3 months ago, I find it's not the technology as much that's the challenge. I think in the blockchain technology as it is today, we feel pretty confident, can enable certainly the processes that we are going after. And I will tell you that, like I said, what makes this unique is this collaboration, these companies coming together and, really collaborating. And that I could tell you that because we're working very closely together, it is a very collaborative, and, it's really 5 companies that are respecting each other's point of view and perspective. And that's actually been a lot of fun to be part of the alliance. And so if you had asked me this 3 months ago, I would have told you probably the biggest challenge would be the collaboration, because you have, 5 companies, that have obviously goals and strategies. But I'll tell you what has been really a pleasant surprise for me in this is how excited everybody is that blockchain, it's really a promising enabler to a couple of challenges that have been challenges for a long time. And so there's an excitement there. I think there's also a willingness to really, like I said, go across company boundaries. And then we're also working very closely together and then building on each other's ideas. And then there's also a very strong sense of execution. So as an alliance, we have work streams. The work streams meet pretty regularly. We have very project plans and charters. And so there's also an element of execution, which, in a relatively, kind of short time that we've been operating together, it's pretty impressive to me how much progress we have made and how much commitment there is from all the 5 companies. And so I would say it's really just, kind of staying the course and executing against our plan. But I don't see challenges. I think the technology is further along and that I think it'll support our needs. I think the collaboration aspect and being able to make progress and, in collaborating with 5, pretty strong, bright companies. I think so. I feel like, I would say from a challenge, I'll tell you probably from a challenge perspective, it's making sure that we keep the industry appraised of our progress, because, balancing the fact that we start with a small group to get the pilot done, but knowing that our goal is to actually have as many participants as we can. So that's probably the challenge is how do we balance working with the smaller, set of founding members to execute on our pilot, but then keeping the industry coming along with us on the journey, knowing that we want to stay a little bit small for now because we got to manage and get it done. But then, we want others to participate, and we want to create this community, right, that improves the quality of data and improves the processes and reduces, the administrative burden, which, and do it through technology, which is terrific.
Right. No, it's got to be exciting, right? So it's not the technology as it is with most large, complex initiatives. It's never the technology. The technology is something you can manage and control. It's always the change management and the all the people management and collaboration and that kind of stuff. It's very well said. So that's fantastic. I really look forward to following the progress of this project. Before we close, do you want to share any updates on any of your other collaborations that you've got going on, the data diagnostics and the other collaborations? Anything you want to share with our listeners?
I think we continue to drive our goals of connecting consumers, providers, payers, and ACOs, right, with actionable insights that are based on lab, clinical, and other health data, right? So we continue to really innovate on our quantum portfolio of services. We definitely are seeing a very positive response from our customers, and that's nice to see. It's nice to see that our various audiences, whether it's a consumer, we're now up to 5.3 million consumers that are interacting with us on MyQuest. Last time I spoke to you, it was 4 million. So, this is terrific.
Yeah.
We have providers are excited about our Quantum for Healthcare Providers portal that we're now converting customers to. There's been a lot of positive feedback there. We've actually, brought on some new services, new online services that really provide some digital differentiators for our customers. And then on the data front, we acquired a company called MedXM, which is an extended care services company, and it's great that we're actually, that acquisition just happened pretty recently, and they're leveraging, now that they're part of the family, they're leveraging our big data, insights and platform, and we're finding a lot of new opportunities to continue to, grow the business and then enable the industry to make better decisions. So all good. We're excited about all these developments, and we continue to just innovate on our offerings and bring solutions that, really empower better health with diagnostic insights out there. So
yeah. I interviewed Dr. Dunleavy from Innovalon in my last podcast, and they just did this big acquisition and everything. And I know that you have a partnership with them, which is on the data diagnostics side of things. So you're obviously very successful, and the collaboration model is something that seems to work well for you. So all the best for this one as well.
Yeah, thank you. We very much believe that healthcare is a team sport, and we enjoy it.
Wonderful. Once again, thanks for taking the time, Lidia. It was wonderful talking to you.
All right. Thanks, Paddy. It was nice talking to you as well.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.